Hello, welcome to Native Yoga Center. My name is Todd McLaughlin, and I recently received an inquiry on how do I forward bend with spondylolisthesis and know where the proper amount of depth is. It's a great question. And I've created a few videos on yoga for or with spondylolisthesis because I have spondylolisthesis. What is spondylolisthesis? Spondylolisthesis is when one of the vertebra typically slides forward. So here we have the L5, L4, L3, L2, L1, 5, 4, 3, 2, 1. And then you have this intervertebral disc in between. So what can happen is the vertebra can actually slide forward, which, because the spinal cord travels here in between the spinous processes or just anterior to the spinous process, it can create some stenosis, which is like a narrowing of the canal, which can put pressure on the spinal cord. It also can put pressure where the nerves innervate on either side of the spine, where we have what are called the transverse processes off to the side, and then the nerve roots, they innervate at the side. And so sometimes the pressure right on the nerve, it hurts like heck. Are there surgeries? Yes. Have I had surgery? No. You may have already had surgery if you have spondylolisthesis. You may have received a diagnosis that you have spondylolisthesis or a slipped vertebra. And then the first thing is you're going to have to be bolted down with a fusion surgery. And there's a lot of different options out there. I do recommend consulting with a medical professional always. And my information for you is just based off of my own personal experience with practicing yoga for the past 30 years, finding out that having back pain for many of those years, and then more in the past 3 years, 3 years, getting the diagnosis because the pain got so severe. So now I modify my practice according to how I feel. Some days I feel amazing. Some days, like right now, and like the last 2 weeks, I had a flare up. So it's been challenging to say the least. So now the question is, well, one of the main things that I pointed out to this particular viewer is that, here I'm just using a chair to make it real simple to start, is that when we go into a back bend, that typically pushes the vertebrae even more forward, which can increase the compression on the posterior, hence the spinal stenosis, the narrowing of the canal, and that can really exacerbate the intensity of the discomfort or pain. So typically back bending really needs to be done with limited amounts. Twisting we also need to be very careful of. And so strong engagement of the abdominal core and very stabilized rotational motion, not just twisting to the absolute max, very important. Now, forward bending, the vertebra has slid forward. In my case now, your case is going to be totally unique and totally different. So what we find is that we need to start investigating what range of motion creates any type of sensation. So we have a lot of potentiality for movement in relation to the pelvis. The pelvis can either tip backward this way, which is called a posterior tilt, or the pelvis can tip forward this way, which is called an anterior tilt. Now, what I'm doing right now, all of this I'm doing in a chair because I recommend try figuring these movements out and exploring and experimenting with this while you're seated in a chair where your knees can be about the same height as your hips and your feet flat on the floor, so you're not elevated and they're flat. All right, so this is a cat-cow, the cow-cat. Cat-cow is a movement that we do all over the place in yoga practice. This one is the expression of the cow, which is a back bend, spinal extension, back bending extension. And this is the cat pose, which is spinal flexion. So what you can see is that this is neutral spine. This is spinal extension, neutral spine. This is spinal flexion. Now, when your back is jacked up, sorry for the lack of professional terminology, when you're in pain, sometimes it doesn't matter whether you're neutral, extended, flexed, everything hurts. So what you can do is start to just work with very gentle movement. What I find is very helpful. Like right now, what I'm doing, because I can feel a little bit of discomfort in my back right now currently, if I go into some flexion, which notice I'm rounding my back a little bit and using the abdominal muscles really strong. Very deep, you have transverse abdominis. Superficial, you have rectus abdominis. And then you have your internal and external oblique muscles, which are your rotator muscles in your abs. So the deepest layer is called the transverse abdominis, and its job when it contracts is to seal the abdominal contents. Now, if you think about it, if your vertebra has slid forward, then bracing by engaging your transverse abdominis is creating some type of resistance to the vertebra sliding more forward. So if you push down against your knees and lift and suck your stomach in and try to lift the rib cage up and then do a little bit of rounding, this can create some space in the lumbar. The engagement of the abdominal muscles will secure from the front. It's not that the vertebra is all of a sudden going to slide back into place, but we're taking gravity is pushing down and often pushing into the slip. So what we're trying to do, what you can do is put your hands on your knees, draw your belly in, and then do a real subtle, I don't know if you can detect it, but I'm just pivoting on my pelvis back a little bit and trying to round the lower portion of the low back right now. And this really is if you have the spondylolisthesis in the L1, 2, 3, 4, 5 category. If you're dealing with the spondylolisthesis somewhere in the thoracic spine or even potentially in the neck, you're going to have to work a little bit differently and feel out if I lift and if I extend, or if I lift and I flex and I engage with abdominal core, does that change the sensation an iota or a quanta, a small amount, right? So this is one way to start to investigate for forward bending. Now, if you're sitting in a chair, notice that I can forward bend at my pelvis, but I can do a back bend while I'm forward bending. I would recommend try to avoid the extension work and do a little bit more of the pulling the belly in and up and doing a little bit of rounding and then experimenting with coming forward. And so in the process of taking the belly in, so in yoga terminology, we have what's called Mula Bandha and Uddiyana Bandha. The main one that you'll be working with here is Uddiyana Bandha, which is this lower portion of the abdominal wall here. And so what we can do is start to draw that in. And so engaging Uddiyana, Uddiyana means flying upward. So the idea is that if energy is pouring down and going outward, that by taking the bandha, pulling in and up, that it creates what's a flying up effect, or in other words, a lifting up effect. And this is really important with spondylolisthesis because the wear and tear of gravity all day pushing down can really inflame the nerves and it can be very challenging. So what we do is we adopt lifting technique so that we can minimize that gravitational pressure. So if you're sitting at a desk all day and your back starts bothering you really badly, I'm putting my hands on my knees, I'm pulling my belly in, and I'm trying to squeeze my belly as strong as I can and almost like lift the rib cage up away from the pelvis just to kind of get strength and a little bit of lifting energy. Now, if I want to fold forward to try to stretch that really stiff, tight feeling on the back, I'm keeping the spine relatively locked down and I'm moving and hinging at my hips. If you can learn how to, I hope this terminology doesn't bother you, lock down. So in other words, imagine that you had a fusion surgery already performed on your vertebra, and the vertebrae are unable to move or flex or extend, and you keep this whole section very stable. Now, all I'm doing is hinging on the movement of the pelvis, anterior tilt, posterior tilt, anterior tilt, posterior tilt. But my spinal column, watch the difference, flexion of the spine, extension of the spine, flexion of the spine, extension of the spine. That's the spine bending. What is really, I find what is really helpful, reduced spinal bending, reduced flexion extension, learning to lock down the core and then make the movement from the pelvis at the hips. This is important. Now, usually what gets in the way is tight hamstrings, because watch what happens. I stand up, my hamstrings are now straight, I start to fold. My pelvis is folding. Well, the attachment of the hamstrings at the ischial tuberosity keep my pelvis from going any forward. So all of a sudden, I start to flex at the spine. And as I'm flexing at the spine, now I start to feel pain here where the spondylolisthesis is. So the key is to not flex at the spine, to use your legs and to try to lift with your legs. Like right now, because I can feel the soreness, when I come down, I need to bend. I can push knees back, but to come up, I need to bend and come up standing. And this is a really important movement to learn when you're having to have to lift something and you have a spondylolisthesis. If you don't use that correctly and you use your back and you go to lift, wow, all of a sudden you can be out for 2 to 3 weeks because of the spasm that can occur. So I know often what the feedback that I received from someone recently is that when you went to go to the doctor, and then the first person that diagnosed freaks you out, gives you this horror story and scares you sometimes what they'll say, and this is true, so it's not that they're lying, it's true, that if the pressure goes too much on the nerves, this is where the nerves for the bladder and the bowel innervate. So if you have too much compression, we could lose bladder and bowel function. So that's obviously what we don't want. The other thing you're going to keep getting tested on is, can you feel tingling, or can you feel your legs and your feet? Because if there's too much pressure down here, you start losing the ability to feel your feet. That is often also a really good reason why we would want to go for the surgery, and I'm open to it too. But right now I'm trying to learn how to navigate it. I don't have that tingling, and I still have function. So, that's why I'm still working with it. But I just want to relay as much information as I can that I've learned over the years, because this is important. I'm sure if you're here because of spondylolisthesis, you know what I'm talking about. Now, if you are I don't want to say if you're a back pain sufferer and you don't know why, you go to the doctor, the MRI, they tell you, we don't know. It looks like you're fine, but you're like, I have pain. All of this work is still going to be beneficial for you. Try these different movements out. All right, so now let's evolve to where perhaps we're sitting, practicing a Paschimottanasana. And Paschimottanasana is the classic seated forward bend pose where we try to grab our feet and we fold forward. So the question again was, how do I know how far to go in my forward bends to make sure I am not overdoing the movement in the spine or the lumbar, wherever the spondylolisthesis is? I know it's a really long word, hard to say. Spondylolisthesis, or slipped vertebra. Why I'm not saying slipped disc? Because the intervertebral disc has the ability to slip as well. And here, to be very specific, this is in relation to the vertebra, the bone actually sliding, versus the disc in between the bones. All kind of similar when we're talking about herniations and disc bulge. That can also put a fair amount of pressure. So if you have a disc bulge or a herniation and you are feeling a lot of pain, take a strap, put it on the bottom of the feet. And what we're going to do, I'm going to encourage you to try, is here I'm sitting up tall. Now I am doing a little bit of spinal extension, but let me just make sure I don't spinal extend. And I'm just focused on hollowing out the abdomen. I might even hollow it out to the effect of making a little bit of rounding motion just to kind of open this space. Instead of being back here, just opening the space a little tiny bit and just hold the forward bend right here. Even though I have the range of motion, you may not, but if you have the range of motion to go forward, you might find that lights this area up a little bit. So make sure you just get to the point, or start exercising it to the point where you squeeze your belly really strong. And when you forward bend, you have the spine on lockdown, meaning not bending forward or back. And when you pull, you hinge at your hips. Hinge at the hips. And I'm just going to hold my forward bend here. I'm going to tighten up my quadricep muscles. Super strong. I'm going to still breathe, but I'm focusing really intently on squeezing the belly. Really strong, strong legs, strong belly, and moving at the pelvis. Not feeling any twinge or pinch or compression at the front. And I feel like this hopefully will give you a little bit of insight into how to do. Now, there's a whole bunch of forward bends that we do in yoga all the time. So that rule really just applies, like say in Jani Shirshasana. Well, now the hip is opened a little bit. So it does create a little bit of twisting motion. So we need to be like, one way I can approach the Jani Shirshasana is I'm not going to go for my foot. I'm going to try to sit up really straight. If I do some rotation, I'm just very aware of how much rotation. And holding here and taking the belly and pulling in and creating a little bit of space back here, but not dumping a ton of pressure into the lumbar, the low back. Now, some days you'll feel great and you can do it and it doesn't hurt and you do a little practice and you feel amazing. But then sometimes a little twinge happens and we can't move for a few days and you have to just start all over again. Just how it is. It's okay. Just start over. And once you go through it once and you have multiple twinges and multiple blowouts, you start reducing the amount of things that potentially will blow it out. And when you do blow out, you know it's going to get better. I can work through this. I just have to be really patient and just try to move the body a little bit each day. Don't force it and really work on lock it down, steady movement. And I hope this helps. If you have any questions, please leave a comment, subscribe, hit the subscribe button, all that, like, comment. Thank you. Find us on our website, nativeyogacenter.com. I have a playlist on our YouTube channel, Yoga for Spondylolisthesis, where I try to break down information for you. Thank you for your feedback. I've been receiving some wonderful comments. And, you know, when you are going through this and you know there's other people that are also going through it in the same boat, it actually brings a little bit of solace. Not that you're in pain, but knowing that we can work together. So thank you. All right. Have a wonderful day. And let me know if any of this helps you. Namaste.